We first told you last month about Ascension St. John closing its pediatric intensive care unit to make room for more adult ICU beds.
A lot of you told us you're not really happy. Tulsa will now just have a single PICU over at St. Francis. Ascension St. John's regional president today explained the decision to News on 6's Kristen Weaver. Kristen?
Shannon and Brian, Mike McBride with Ascension St. John says he knows this is hard on patients and employees in the PICU, but he says it's all because they are filling an even bigger need. Ascension St. John is closing 7 beds in its pediatric ICU and 16 beds in its general pediatric unit at the end of next month. It'll make way for a $27 million investment at 4 hospitals in Green Country, including St. John Owasso and Broken Arrow.
Where we can be of greatest help to our community is making sure that there are adequate numbers of critical care beds for adults.
Mike McBride is the regional president and chief operating officer and says even with COVID numbers down, all 60 beds in their adult ICU were full today. Only 1 bed in the pediatric ICU had a patient.
We often have a waiting list for people to get into the ICU.
St. John will add 36 beds to its Tulsa hospital, and another 74 beds will be added across 4 hospitals in the next 2 years. The current neonatal intensive care unit will stay open, but nurses in the PICU have to find other jobs either with St. John or elsewhere.
Many of our pediatric nurses have chosen to stay with us as we open a new woman and children surgical unit.
That surgical unit will be for women and children recovering from surgery. McBride says this pandemic has been very hard for all his employees, and he's grateful they can expand in other ways, even though the PICU is being closed. Now, St. Francis will be the only Tulsa hospital with the pediatric ICU, and doctors there tell me they are ready to take on that demand. The St. John PICU closes on April 30th. Kristen Weaver, Oklahoma's Own, News on 6.